Hi, good morning, everyone, and good afternoon and good evening from other countries, wherever they are joining from. Welcome to 92nd weekly CMAAO international meeting. We have representatives from various countries, and we have been discussing over the last few months on various issues which are revolving around this pandemic. We were there starting 90 like before 91st episode. We were there discussing all the protocols, uh, situations in the various countries. Today we are taking up a very important topic about COVID protocols being followed by the various countries. This will give us some kind of a insight what's going around the world, and it will not only help the doctors but also the general public who is watching this kind of videos to at least understand and what needs to be followed and what is correct and wrong. So shall we start the session with Singapore, the chair of our CMAAO, Dr. Chong?
Thank you, Sarab, and welcome everyone to another edition of our CMAAO weekly meeting. And it's good to see everybody here again. And apologies, last week I wasn't able to attend, had a bit of a family emergency. But I would like to share my screen first. Sarab, will you allow me?
You can do that now.
Okay. So just quickly, can you all see my screen?
Yeah.
Okay, so the situation in Singapore is as follows. Just 2 days ago, we were updated that we had 2,522 cases of Omicron in Singapore so far. It's all coming in because we have opened up the traveling lanes. We call it a VTL, vaccine travel lanes, with several countries, including Europe. And of the 2,522 cases, I thought this was interesting, only 3 required oxygen and none were in ICU. So everybody is very well. And the comparison with Delta is that if we had 2,522 cases of Delta, 30 would require oxygen or be in ICU or would have perished. So this is a very interesting comparison of the Omicron situation in Singapore. Now, I myself had 5 patients who contracted Omicron on their way back from UK and Europe. So I think a lot of the
cases... Sorry, sir, can you put it on presentation mode? Can you slide mode? Can you make?
Oh, okay.
Yeah,
sorry.
If you could just enlarge this. Yeah,
okay, sorry. Yeah, sorry. Can you see
that
now?
Much.
Yeah, thank you. So I myself had 5 patients on the way back from Europe that caught Omicron. The oldest is 27, the youngest is 10. So it really looks like what Dr. Kuzi has told us from South Africa, that it seems to target much younger population. And they were traveling with parents and older people, and they were not, the fellow travelers did not seem to contract it. So that was very, very interesting. We also started vaccination differentiated safe management measures. This is basically vaccine mandates. So from the date of your second dose, from Valentine's Day onwards, if you have not had your booster, you are given 5 months to 9 months to get your booster. If you haven't got your booster, you will be deemed as not vaccinated, and you will not be allowed to go to restaurants and so on, public places. So it's a bit of a kind of a mandate. And this is our latest health protocols as for COVID patients. 1, if you're unwell, see a doctor, test positive, self-isolate at home, and then do a PCR, etc. 2, if you are well and asymptomatic but test positive, because we have distributed ART kits to the whole, rapid antigen kits to the whole population. Everybody has a kit at home, at least 1 or 2 kits at home. So we have told everyone to self-isolate for 3 days, do an ART. If it's positive, self-isolate. If 3 days later you repeat the ART, you can end your isolation. Of course, if you're unwell and so on, and you start to become symptomatic, then go back to protocol number 1. And for protocol number 3, if you are identified as a close contact of number 1, then what you do is you just do the ART, you upload you'll be served a kind of order called a health restriction order, and you will do your ART, upload the results into a website, and continue to do your ART daily. But you can go out if you're negative. You can leave the house if you're negative. And on day 7, you can stop your ART. If your ART is positive at any point in time and you're well, then you go to number 2. If you're unwell, you go to number 1. So this is a very simplified protocol that we have in Singapore right now. And this is in on the newspapers and so on. So, and as for Dr. Alvin Chan's question about uptake of children with vaccine, 5 to 11 years old, we've just authorized Pfizer, and 11% of the kids have taken up the first dose. And that is about 300,000 children who are eligible. About 40,000 odd as of today has taken up the first dose. So we're having a very good, healthy uptake. Of course, it just started a couple of weeks, so it'll take some time. And that's all I have to say about Singapore for the time being. Just one slide, which I spoke about the week before. I remember this data that I saw in children from the FDA committee at about the natural infection of COVID in the US, where 1.9 million children were infected. The 8,003 were hospitalized, 1/3 in ICU, and 5,000 odd had Kawasaki disease or multi-inflammatory syndrome. So honestly, I think COVID in children is not as benign as we thought it was. And therefore the case can be made that yes, we should vaccinate children between 5 and 11. Okay, that's all I have to say for now. Thank you.
Thank you, Dr. Chong, for the quick update. Ravi, would you like to take it forward because you have to leave?
Yeah. Thank you very much, Arab. Thank you, Dr. Chong. That was a fantastic presentation. Well, in Malaysia, what's happening is Omicron is here, but not as rampant as Delta that was here. But we are getting it all, like, we had many of them who went on the Umrah. And when they came back, I think 3/4 of the population went for the Umrah, came back with Omicron positive. However, as of yesterday, we had only about 3,381 positive cases or new cases. And out of which 98.9% were category 1 and 2. And 1.1%, that is about 37 of them, were under category 3, 4, and 5. So you can see the numbers in category 3 and 4 and 5 are very small. The protocol here is this: everybody can now get their saliva test kit, which is available everywhere. And the government has controlled the price so that it is not expensive. It's only about 5-6 ringgit per test. And if any of them is positive, then of course they have to go and confirm it with an RTK antigen or a PCR. And saying that if they're positive, what happens, then they have to self-quarantine themselves. And unless they have some symptoms, they don't go to the Ministry of Health. So if, let's say, they're in category 1, 2, and 3, they just remain at home. And once they're out of it, then they go back to normal. That is the status here in Malaysia. There are a lot of SOPs in the country, like face masks, social distancing, washing of hands. And the government is encouraging everybody to make sure they follow the SOP. The vaccination process is going on, especially the booster. The booster, there seems to be much hesitancy because those who have taken a different dose, different vaccine, they don't want to come and have a mix and match with Pfizer. So they are frightened. The social media has been putting up all articles on this. But as medical people, we are now encouraging everybody to go for the booster dose. Children 12 to 17 are all vaccinated with 2 doses. But the 5 to 11, they have not started in Malaysia as yet. They haven't started anything yet. So that is the status of Malaysia. Thank you.
Thank you, Dr. Ravi. Um, can I have uh, can I have an update from Pakistan? Who's going who's going to present from Pakistan, and then we the other members can add. Dr. Salma, Dr. Wazi.
Uh, Thank you, Saurabh. I think Dr. Tessa Sajjad is not there. So I'll try to brief what is happening in Pakistan. Uh, I mean, as we are all talking about, is the self-care is the priority at the moment. And after exposure to someone who has COVID-19, it is advisable to go for a healthcare provider and to get tested by PCR, because we don't have home kits available here. So the facilities, healthcare facilities are there to get their PCR or rapid testing done. And once they are tested positive, they are advised to stay at home and quarantine themselves, isolate themselves, and follow the protocols of all the prophylactic measures, uh, using mask and distances from the maintaining distance from others and hand washing and all that. So, and they need to, get them tested after 3 days if they were positive. And again, if they are negative, even then they are advised to get them tested. And following that, over here, initially it was for the 14 days. Monitor yourself for any symptoms. And once you're okay and your test is negative, then you can, move around. So this is self-health care. And if the symptoms are there, you need to get yourself to the hospital facility. Plus, we have in the province of Sindh, the telehealth care system very effectively working. Those who gets positive, they are being monitored by the telehealth IT health facility, and they keep monitoring them, and they provide them the healthcare provider services through phone, or if they need hospitalization, they even provide them the facilitation of getting admission in the hospital. I mean, once in the hospital, the routine for treatment measures are there, protocols and guidelines are there, and that includes all supportive, including oxygen for severely ill and those who are at risk for severe disease, and more advanced respiratory support such as ventilation for, and that's available with them. uh, we have about 70 million people in Pakistan who have had their 2 doses, which is the 32% of the population. And now government has authorized booster doses for citizens over the age of 30, and children over the age of 12 are being offered vaccinations at their schools. But this is not very effectively going on, because people are very hesitant, especially the parents are very hesitant to get their children vaccinated. And regarding the Omicron, since we do not have very good facility of genome sequencing, so a few hundred cases of Omicron are there in Pakistan. Uh, uh, 2 days ago, the number was 372 cases of Omicron. But I suppose yesterday I was watching TV, and they said in the horde they had more than 300 Omicron variants found. So the first dose we already had over 99 million. Fully vaccinated are 73 million, and the confirmed cases till today is about over 1 million. And in the last 24 hours, we had 1,293 new cases, and it's increasing. I mean, it was in few hundreds last week, and now it's increasing to the. Then in the last 24 hours, we have 6 deaths, uh, which is still low. And the recovered cases, we have over 1.2 million. And in the last 24 hours, we had 239. And the number of tests are growing up, over 23 million we have already had. So this is what the situation is. The people are not, following the SOPs, despite the fact that the government, health authorities, and even Pakistan Medical Association is very vocal on the media and trying to, convince the people to follow the protocols in order to halt the spread of the disease. Okay, thank you, Sarab. I think that's.
Thank you, Dr. Kazi. Anyone wants to add? Dr. Salma, Dr. Bukhari?
No, it was a well-rounded information that Dr. Kazi gave us. I even mentioned last time, and I'll again ask the same question from all the great minds over here. If we've had 2 vaccines of Sinopharm, can we take the third as a booster dose? You were saying there was little data available, but don't you think there should be enough data from China, and is it safe or not? That's my question to this forum.
Dr. Sama, can I tell you what we're doing in Singapore for the Sinopharm and Sinovac vaccine?
Yeah.
Please do.
Yeah. Yes. So in Singapore, we have decided that 3 doses of Sinopharm or Sinovac is considered a primary course. So the third dose should be taken about 3 months after the second. So a complete course of Sinopharm or Sinovac is actually 3 doses in Singapore.
Okay,
and
great.
yeah, and I'll send you our ministry directive on this matter. And we've also started doing boosters for people with Sinopharm or Sinovac. And I will also send you a table where it shows the booster regime for Sinopharm or Sinovac.
Okay, I'll just put my email here in the chat group, so please do that. Thank you.
Thank you.
Thank you, Saurabh, for inviting me. One more thing that I would like to add in the discussion of Professor Kazi, Dr. Kazi, and the protocol in the Pakistan. Every 2 weeks, we have the meeting of NCOC of the government level. And the government was just thinking increasing. One thing more, the government has also allowed the booster dose for the children above 12 age. And as the Professor Kazi has told that it was before for the above 30 years. One thing more about the booster dose. Booster dose, we are using the Pfizer's. We are not using the booster dose the same, the Sinovac and the Sinopharm, because the data on the NCOC and the government has taken the data that the Sinopharm or Sinovac is weaker against this Omicron. That is why we are also using the Pfizer for the 12 years, above the 12 year, and 5 to 12 year, we are also giving the Pfizer dose. Same as the Dr. Om has told, there were very few uh, myocarditis case in the Pakistan. Hopefully, uh, the things are going controlled, and no doubt we are in the fifth phase, but the fifth phase is very slow. Thank you very much.
Thank you, Dr. Bukhari. That was an update from Pakistan. Can I invite Dr. Monica Vasudev from US?
Thank you, Saurabh, and wishing everybody here the best of 2022. I believe this is the first time I'm seeing everybody in this year. Hopefully we can herald on a better year this year in the setting of a better vaccinated society and a surge that will come and go quickly. I'm just going to give you the updates in the least amount of slides that I can. Okay, this is the data on this week in the United States. What we're seeing as of today, there was 59,000, almost 60,000 cases, of which there was 900,000 new. Total deaths was 2,500. Over 3 million tests were conducted today. Almost 5,000 were hospitalized, with an additional 400 people in the ICU. We are rapidly surging all over the country in every region. We are strapped in terms of access to hospital beds. So even though overall the infection is milder, it is not mild for everybody. If you look at what the hospitalization rate was a year ago, we had 132,474 people that were hospitalized on the 6th of January. And this was when we did not have a completely immunized society. And if you look at the 6th of January, when people are immunized, we're still seeing a very high surge of 126,166. So that is the hospitalizations, not the infection. So I'm trying to put in a lot of information in the one slide. So this is it. The big news this week was the return to work or return to school, their isolation time after a positive COVID test. And all of you are aware that this was decreased by the CDC from 10 days to 5 days. Sure. They felt that I think there was multiple forces, multiple thoughts that went behind this change. And the biggest concern was the return to work, return to school concept in terms of how infectious was somebody 5 days after a test or at the beginning of symptoms. So here I'm reporting to you what we are doing in my healthcare system. So if you're symptomatic and you have a positive COVID-19 test, then you will be isolated for 5 days, and then you return to work in 5 days as long as you're not symptomatic and you are wearing a mask. But we are obviously wearing a mask at our place of employment. If our test is negative and you've been exposed and you're asymptomatic, you can return to work without fever or significant respiratory symptoms. How that's translating in the schools is that if you are vaccinated and exposed, you can return to school. So if somebody in your household has a positive test and you're fully vaccinated, you are not isolated and you can return to school. There's a lot of confusion and a lot of discussion related to the return to work, return to school, and the isolation period, given that there was no recommendation made for having a negative test come back out of isolation. And I believe that the motivation behind that is because there is a significant shortage and access to testing in the United States. We have both hospital-based testing, we have proctored home-based testing, and we have at-home antigen tests. There has been a significant undersupply of the at-home tests due to a reduction in production and other factors. Maybe the focus was on vaccination rather than testing, that during the holidays and with everybody returning to work, kind of timing with the surge in Omicron, that we now have no tests available if we want to. And I believe that there's a black market for this. So that's where the CDC's motivation may have come from in terms of why they did not include testing as part of their return out of isolation. This next point is regarding the monoclonal antibodies, the sotrovimab. It is found to be effective in treating the Omicron variant. As I had indicated 2 weeks ago, Regeneron, a monoclonal antibody that was frequently used, was found not to be effective, and therefore this was discontinued. There was another monoclonal antibody as well. What we're finding now is that there's a very low supply of this monoclonal antibody, that there is an ethical approach in terms of rationing of this monoclonal antibody to make sure that we are actually preventing illness and mortality and reducing the strain on the healthcare resources. We now have the two oral therapies, the Paxlovid and the Molnupiravir. It's received EUA by the FDA. It's being distributed by our Health and Human Services component of the government to pharmacies that were distributed last week. And these medications were intended to avoid progression to hospitalization and death. And it was meant to be used in the outpatient setting only. From the American Association of Pediatrics, speaking to comments made earlier, we have had an increase in pediatric cases and hospitalizations. For the week ending December 30th, over 325,000 child cases were reported, which is a 64% increase reported in the week ending December 23rd, and almost doubling of cases from 2 weeks prior. We had the approval of the boosters for the Pfizer-BioNTech mRNA vaccine for the EUA in children aged 12 to 15. And that was approved 5th of January. And I know as of today, of patients who are receiving the booster dose in this age group. There's also been now new reported cases of concurrent infection, not immunization, and the SARS-CoV-2 infection. And that's it for the American update.
Thank you, Dr. Monica.
Dr. Monica, can I have a question? Dr.
Sure.
Monica? Yeah, you're just showing it. Actually, maybe some disruption because I am on the way. Sorry. It's in America, we have seen that the same number, almost near about similar number of hospitalization. We have just you are just telling it, just comparing the previous year. So, what is the actually the population? And the ratio between the vaccinated and unvaccinated in hospitalization, what is that? Thank you.
Oh, so these are great questions. So I believe that the most recent number I saw was around 95% were Omicron that were infected. The percentage of hospitalization, yes, it is 95% right now. And this was as of 3 days ago. So that's probably even higher right now. In terms of those that are percentage of Omicron that are hospitalized, I'm looking that up right now. I'm sorry, I didn't have that data. I am sorry, I don't have that on the tip of my fingers right now, but we do know that the amount of percentage of hospitalization is much lower than it was for Delta.
Do you have any other questions?
Say that again, sorry?
No, you said hospitalization is low. In that
Yes.
case, the number of hospitalized patients are the same like last year. So
Yes.
remaining are delta. Remaining are
No.
delta.
Yeah, this is reflecting a higher number of cases that are positive. So the total number of people infected are much higher. However, the hospitalization rates is still high right now.
That means remaining That's why the question was very important. In case you have data, maybe next time you show us how much is the percentage of Omicron variety patients infected, hospitalized.
Okay, I will try to find that for you. You can go on to the next speaker and I'll bring the next, I'll try to find that answer for you.
Thank you.
Dr. Jamal, would you like to go forward for the next update till Dr. Monica finds the data? Dr. Jamal, would you like to give an update? Okay. Dr. Russell from Australia.
Hello.
Good day, everybody. Happy New Year or happy 2022. Thank you, Sharab, for all what you're doing. Look, from Australia, we are in a bad state here. Unusually, this is overwhelmed the major two states, and I think today it's around 115,000. Probably we per capita, we're probably exceeding US also at the moment. That's what I saw yesterday. And of course, the large numbers has affected the the major problem we're having is the impact on workforce. So New South Wales, they have over 2,800 hospital healthcare staff who are isolating or sick. Similarly, so it's becoming a state where although the admissions are unlike the past, we still have New South Wales has got 1,795 in hospital, 145 in ICU. Similarly, Victoria has got 731 people in hospital with 100 in ICU. Capacity is there. We have for beds and ICU. It's well, but the workforce is getting affected. So that's a big issue. And as you know, we are like different countries. So Western Australia, completely, they don't have any patients, any cases, right? But no one else can go there, blocked completely. So here in Victoria and New South Wales, it's very bad. Now they've made some, we are all into the booster. Now they've reduced it to 4 months. And from the 30th of this month, 3 months is all that's required from the last dose to get your booster. We've all had our booster. The booster is predominantly Pfizer, because there was a fair number of people who had the AstraZeneca, particularly those who are above 50. But now everyone are getting the Pfizer or the Moderna. These are the two being given. Then from this week, the 5-year-olds start getting their, again, it's Pfizer vaccine. I think that what Monica had shown, 1/3 dose. So that starts from this Monday. So they're actively doing that. But they've changed some of the rules in sense we are not able to cope with the PCR testing because of the large numbers. So they've now opened up this the rapid antigen RAT test. And unfortunately, here again, there's issues with supply and demand. And so they, while the government is, arranging for it to take, it's going to take a couple of weeks for the logistics and supply to come. So right now without the PCR, just getting a RAT test, if it's positive, you start your isolation. As you know, from that day, you can then ask, and there's also mandatory reporting is coming from yesterday. So there's a channel which you got to report. And so that's the other part of it. All the RAT tests have to be reported now, and it will be also accounted for. As you said, we've got the monoclonal antibodies. I think it's the Glaxo, that Smith claim that's being used. But of course, for people who are, I think, above 60, who've got comorbidity and so forth. So they've got a hospital in the home where you go into the hospital and get an infusion. They arrange for that of the monoclonal antibodies, and both the other Pfizer and the other one that's also become available. But it's this cases, and further than this, we are struggling with a new problem in that the workforce and the supply chain has got affected. So food scarcity, I mean, all these type of things are coming up. Hotels, restaurants are closed because they don't have staff. So we are having a bit of a problem in Australia, or at least in the major Melbourne or Sydney particularly, New South Wales, and to a lesser extent Melbourne or Victoria, which is these two. And with this has now come changing in terms of they opened up everything, and now again restrictions have come. They've stopped pubs, dancing, all that things, and density limits have been brought in. Masks are mandatory now for all indoor, except in Western Australia. All the rest it's become mandatory, and I think they're enforcing that, getting fined and so forth if you don't wear the mask. So the situation is, unlike the past, this time seems to be rather difficult for all of us here at the moment, particularly the hospital where the workforce is really impacted on. We have doctors, and I remember seeing Monash, Dr. Chong, where your son is. My daughter's there too, and so we were looking at they had, few, just for last week, they had 200 odd patients with COVID, but they had 400 odd doctors and nurses who are off with COVID, you see, almost double the number of, so that's impacting a lot on. And then, of course, they're wanting to discharge you faster. So patients who are cancer and the others are all getting affected. So that's the situation now in Australia. Hopefully, the next time things are, I think they're expecting to peak in February, first week of February or second. They're expecting, and yeah, that's the calculation for the peak for New South Wales. Yeah. Thank you very much for that.
Marie?
Yes, thank you very much. May I share my slide?
Yes, absolutely.
And yeah, just a moment, please. Okay. Here in Japan, we are experiencing the sixth wave. Can you see my slide?
You can see.
Yeah, we have just started the Omicron wave and experience Omicron wave right now. And unfortunately, the Okinawa, the southern island, is a center of the pandemic because there is an USA base, so that's the USA base for USA rule. So everybody, not everybody, but many people are not wearing masks and going out and dining with friends freely. So they're experiencing the worst in worldwide because there is a 2,000 out of 10, 100 million people are tested positive during these 7 days. It is worst in world. So in Okinawa, the trend is very getting high for tested positive for COVID-19. But fortunately, we are not experiencing the death at all. No one has been transferred to the ICU or ventilated. So we are now, after spreading all over in Japan, so how Omicron affected the elderly people, we are not sure about that. Of course, we are vaccinated, all about 80% of the people are fully vaccinated. And we started booster for elderly and the medical staff right now. So we hope we are not for late for anti-Omicron. So in Japan, basic protocols are all the same as Delta. So who has symptoms, we quarantine for 10 days and close contact for 14 days. But we are now knowing about Omicron a lot. So we will change the protocol in near future, I think. So we are doing some cities for mild lockdown. Don't serve the dinner after 10 o'clock or something like that. But in Tokyo, we are not planning what going to on for Tokyo area. Thank you very much.
Marie, can I ask a question?
Yes, sure.
I remember that the Delta in Japan was going into a sort of like a evolutionary dead end. You know, it was getting milder and milder and milder. Is that the case still in Japan?
Yes, yes, that's right. So in Delta case, we explained the harsh one, but it's faded away. We don't know the reason why, but yes, as you mentioned. Thank you for asking.
Thank you.
So thank you, Marie. And Jamal, are you there, Dr. Jamal? Okay. We will let Dr. Jamal speak later. Dr. Angelique and Dr. Akhtar from South Africa.
Good morning. I will just briefly give you a background what's happening in South Africa, and Dr. Hussain can present you with all the numbers. I will give you some update on our ICU because I don't think he's got that numbers. So from the 31st of December, we don't have any restrictions on movement. We lifted all of that. The only measurements in place is still indoors and outdoors gatherings. Regarding indoors, we have now moved up to 1,000 people indoors. I think this is because of pressure from the churches, especially around the festive season, and the government succumbed to that pressure. But the most important thing in our country is still the compulsory wearing of masks, as well as the social distancing, hand wash, and ventilation, which I think is extremely important. We started at the beginning of last week with booster injections for people over the age of 50 and those with comorbidities or immune compromised younger than that, but then you need to have a letter from your doctor. We still have children being vaccinated from the age of 12 upwards. And with the current situation in South Africa, I don't think we are going to recommend even children under the age of 12. Again, what we are seeing, a very fast spreading viral infection. But interesting enough, once it reaches its peak, it comes down, the numbers comes down just as fast as it went up. And I think this is the nature of the virus. I don't think there's any specific reason, it can't be contributed to vaccines or anything else. I think it's part of the viral infection. I have heard about the healthcare workers that get infected. South African experience during the Delta wave is that these healthcare workers that got infected in our hospitals was mostly not due to infections from patients, but due to the fact when they have their meals or tea time that they abandoned all protocols and then actually get infected in that way, and not as much from working with sick patients. Again, the numbers, as Dr. Akhtar will show you, is going down in South Africa. And it's still, I know the world doesn't want us to say that it is a mild disease, but unfortunately there's a definition for mild disease, and it is still a mild disease. What, however, I have noticed with some of my patients is that out of 118 patients I've treated, I have sent 4 for admission, who all 3 of the 4 didn't come when they were sick in the beginning, and they all have all of them are above the age of 50, 2 of them severely overweight with diabetes, and luckily these patients didn't need ventilation, and 3 of them are already being discharged. So the amount of people, because there's a lot of talk about vaccines, if we look at some of our data, there's no really difference between vaccinated and unvaccinated people getting mild disease. The difference only starts in hospitalization of in ICU and in high care. There's a difference that your majority are unvaccinated, about 88% according to one of the latest studies are unvaccinated. So I think it's important to let people know that even though you are vaccinated and even though you get boosters, that you can still get mild disease. And we need to be honest with the patients out there or the public regarding why you need a booster. And I'm afraid going forward that at some stage we're going to lose the public's interest in getting boosters. And I think it's important to try to teach people how to live with the virus. And the mask wearing are one of the most important aspects of trying to curb the spread of this variants or viruses that we are still going to see coming forward. In South Africa, we have never stopped the compulsory wearing of masks, but now it's even better enforced. Just want a very brief update on our ICU cases of yesterday. Sorry, I just want to get them here. Again, this is data from 666 hospitals. Our ventilated patients is constant for the last few days on 304, so means it's the same people. Our currently oxygenated 1,300 over 666 hospitals, and our previous admission on the day on Thursday was 361. And currently in ICU is 682 patients. So we don't see the children anymore. Right in the beginning, the children were the most affected. Now we are seeing, as in any of these previous waves, that it's more the 50 pluses and the unvaccinated people that will progress to more complications or severe. And the type of pneumonia that we are seeing from the primary healthcare facilities, sending them into hospital again, is that shortness of breath, and you can hear the pneumonia clinically. You can pick it up on your stethoscope. Again, it is around about the comorbidities that these patients have that you really need just to double check with them in the hospitals and make sure that they get through this. None of my patients so far died of, or any of the family members that I am aware of. And yes, a lot of patients doesn't even test anymore. You know, they accept the symptoms. If one in the household had got it and that person was seen by the doctor, and the rest then get infected, and they don't even bother to test anymore. And I think that's going to happen in a lot of other countries. I don't think that's going to be unique to South Africa. Thank you so much. Dr. You can give the numbers?
Thank you, Angelique. You cover almost all the statistics as well. Only thing I like to add few points. New cases last 24 hours, 9,260 all over the country, and the death was 140. The positivity was 20.2, according to the tested 45,843. The treatment guideline and protocol, I will just read or say key recommendation of South Africa, how we have been treating, especially hospitalized patients. Number one was dexamethasone is recommended for patient required supplemented oxygen or mechanical ventilation. Other point was heparin, venous thromboembolism patients for prophylactic doses recommended all hospital patients. Baricitinib was also recommended for 2 weeks, those who have required oxygen either on ventilation or nasal prone. What we recommend against the following medicine for COVID-19 is the chloroquine, hydrochloroquine, leponavir, ritonavir, interferon beta A1, azithromycin, colchicine, non-steroidal anti-inflammatory, including aspirin. we suggest against the use of following medication for COVID-19. That's a tocilizumab that is a very expensive for South Africa, and remdesivir, mucolytic, BCG, convalescent plasma, IV immunoglobulin, ivermectin, vitamins D, C, zinc, we don't recommend, inhaled corticosteroid, and those are the hospitalized protocol in South Africa. As Dr. Angelique mentioned, we don't do any more contact tracing, things, and isolation is shortened down. We'll do only the very sick patient, 5 to 7 days. Lockdown, we have lifted the lockdown. It proven that lockdown didn't help much, except it damaged the economy. So 70% of the population already infected between first, second, and third and fourth wave. So Omicron is still, we are treating as a very mild disease. Thank you.
Thank you, Dr. Akhtar. Can I have Bennett from Pakistan? Dr. Bennett? Dr. Benito, are you there? Okay, so can we...
From the Philippines, not
from the
Pakistan.
Philippines, sorry, yeah, sorry.
As at the moment, last week we had less than 400 cases per day. Starting January 2, the surge, we had the fourth surge due to Omicron, with the total number of positive yesterday as of January 7, we have now 21,819. Previously in December, we have less than 500, 400. And number of positive 2.7 with active number of 77,369 active cases. Number of deaths yesterday is 129 with a total percent of death since the start 1.78%. Total of deaths 51,871. Number of cases 2.9 million. Then regarding the hospital capacities, ICU beds for National Capital Region, 48% utilized, while the rest of in the country is 32% utilized. And since January 3, we gave the Philippines the alert 3 for the from alert 2 to alert 3, the level of awareness for our containment of the COVID-19 in National Capital Region, including the different nearby provinces. And the Department of Health issued the new quarantine guidelines for our healthcare workers. The COVID cases rising in the Interagency Task Force has declared alert level 3 starting January 3 to 15. And below the quarantine guidelines as follows: exposed to suspect or confirmed cases, fully vaccinated, they must be quarantined for full 7 days. Then not vaccinated, quarantine for full 14 days. Then for the confirmed cases, mild to moderate, if symptoms, isolate the full 10 days from the symptom onset. Then if asymptomatic, they must isolate for full 10 days from the time the test was taken. Then some of the common COVID symptoms were fever and chills, muscle pains, headaches, cough, and we gave anti-2C, productive cough, expectorant, nasal itching, antihistamine, chlorpheniramine, then congested runny nose, decongestant, and for the treatment for the mild to moderate, non-hospitalized, we gave casirivimab and Noviravir. With these drugs is under emergency use authority. Then for moderate to severe, we give remdesivir, dexamethasone. Then for the hospitalized COVID-19 patient, we give baricitinib in addition to other drugs. Then with patients showing rapid respiratory distress, we give tocilizumab plus systemic steroids. Then hospitalized patient with moderate to severe to critical COVID, we give standard dose of prophylactic anticoagulation. Then patient with severe to critical, we give dexamethasone 6 to 12 milligrams per day. Then for prophylaxis medication, subcutaneous use of casirivimab and another drug, imbedim with emergency use authority. And now we have increasing cases of COVID-19 among children, and we will start giving the vaccine for the 5 to 11 years old starting February. As of now, we have almost 51 million Filipinos being vaccinated. And we should vaccinate at least 70 to 80 million. There are many, until now, there are many unvaccinated. And our problem now is the typhoon hit areas, 10 provinces in the Philippines, and we have they lost the houses, and 90% in one province there, 95% is totally devastated, and we need to give them the relief goods. And as of now, we are starting giving them the COVID-19 vaccines for their second dose and booster shots.
Thank you, Dr. Benito from Philippines. And can I invite Dr. Matinda Pillai for India, followed by Dr. Nidhi Dhawan? Dr. Pillai.
Hello. Thank you. As far as India is concerned, we are slowly inching towards a third wave. The number has been around 8,000 till end of December, and within a week it has spiraled up to 1.4 lakhs. So we are really into the third wave. That's what is happening. Then, of course, as far as Omicron is concerned, the total number as of today is around 4,000, particularly from 27 states. 4,000 cases has been reported of Omicron. And among the Omicron, there have been 2 deaths, one in Delhi and one in Bombay. And details of the clinical profile of patients with Omicron is not so much available. But then so far, it is still categorized as a mild form of infection. And as for vaccination, first dose has been almost given to 94% of the population, and 2 doses to 64%. And now, from January 1st, children above 14 years up to 18, they are also included for vaccination. And the Covaxin, the one developed indigenously, is being recommended for the pediatric age group. And from 15th of January, the booster dose will be given to elderly people, those above 60 with comorbidities and health workers and other categories of people who come in contact with the public. So that from 15th, it will be started. And the same vaccine they are taken as the first and second is recommended for them so far. So that is the situation on that. Then the test positivity used to be even up to 20% and all. Presently, it is 7.6% test positivity. Hospital admission used to be around 10%, now it is 8.6%. And ICU admission, where people really need ventilation, again is 0.8% of the patients. So that way, the severity and mortality has not gone up, but the number definitely are going up. As for restrictions, in no state there is any lockdown, but then night travel restrictions are there in some of the states, and Sunday restricted movements are allowed. But travels, again, international travels, 7 days of quarantine, and then do the test if it is antigen negative or RT-PCR negative, another 1 week of self-isolation. That is what is recommended now by the government. And but this is not very strictly followed. There are limitations in sticking on to that. Crowd management definitely is happening. The number of people who can collect indoor has been restricted to 100 maximum. Social functions up to 20 people can, marriage or death or whatever, 20 people can gather. So those crowd management restrictions are much more strictly now followed. And that is where we stand. As for the management, category A, that is with mild symptoms of sore throat, fever, malaise, or cough, they are allowed to be in self-isolation at home. And all those people who have more symptoms are asked to report to the hospitals. And category B, those above 65 years, even with mild symptoms, and those with comorbidities are again included under category B, and also those with mild symptoms. Category C is those with who have severe symptoms. The COVID markers that are normally monitored, particularly those with moderate to severe disease, are CRP is done, ferritin, LDH, D-dimer, and these are the tests that are being done. And if the D-dimer is high, then anticoagulants are definitely given. D-dimer to the level of say 1,000 or so. If ferritin is high, 425 range or more, then definitely they are given steroids. So now the first line of management, wherever people can afford, is monoclonal antibody cocktail, which is given even as a daycare sort of thing. Those with mild to moderate symptoms, they are given, and those are in the higher categories. They are given monoclonal antibodies as a daycare. By evening, they are allowed to go, but they are monitored by telemedicine or otherwise. And if most of them who get the monoclonal antibody, none of them definitely don't go for severe infection. That is something which we have already noticed. So the sheet anchor of management is monoclonal antibodies and steroids if ferritin is high, D-dimer if it is high, and then heparinization or anticoagulants are being given. Antiviral drugs, remdesivir, definitely those who need admission and where they're not improving with supporting management, within 10 days, if they are getting worse, they are given remdesivir for 5 days. And the newer oral antiviral drugs like molnupiravir and Paxlovid, the molnupiravir has been accepted by ICMR, but the drugs has not become available in our country yet. But the molnupiravir may become available in the near future. So that is regarding the management. So anticoagulants, steroids, whether dexamethasone or methylprednisolone, and very rarely if people are not responding to steroids, then JAK inhibitors are also advised, but selective cases that is being given. So that is regarding the management part of it. All those peripheral drugs like vitamin supplementation and other drugs, chloroquine and things like that, none of them are now recommended or used in the management in our country. So this is in short what is happening in India. Thank you.
Dr. Pillai, what is the percentage of breakthrough infection in hospitalized patients of Omicron?
Hospitalized patients, the number is very, very less. And those data are still not available in the public domain. And maybe it will take, this is hardly 1 week, and it may take some more time before we have more of information on Omicron alone. But as of now, only 2 deaths has happened out of almost 4,000 cases.
No, if the breakthrough infections is high in Omicron, then how far it will be advantageous for all of us to get booster
with
dose
Omicron, whatever has
vaccination?
whatever has been reported, it is upper respiratory infection that is more common with Omicron and not lower respiratory infection as is happening with Delta. Pneumonia and other things are not there. Even oxygen supplementation, to begin with, little drop, say 99, 98 oxygen supplementation used to be given. Now only if it is below 94, oxygen supplementation is given. And first, of course, definitely is respiratory mask and ordinary mask, and then high flow nasal strongs, and then, of course, non-invasive ventilation, and then invasive ventilation. But if a person needs to be put on invasive ventilation, almost 90 and more % of death happens in that category. So if we can sort of save a patient with high flow oxygen, then it is okay. But those who go beyond, even non-invasive ventilation, we find that mortality is higher. But if they go for invasive ventilation, intermittent positive pressure ventilation, then very few among that category we have been able to salvage.
My question is, all new patients coming in, at least Maharashtra, they are healthcare workers. Majority of residents getting infected, and all of them they have already received booster, say double dose. So what is the advantage of giving a booster dose or looking for vaccination in case we are not able to prevent Omicron?
No, vaccination definitely. Those who are vaccinated, even though they get infection, they are very mild and mortality is much, much less in that category.
Okay, Dr. Pillai, can I ask about the Delta variant? Do you have any cases of Delta variant also apart from the Omicron, number one? And the second question is that do you have any symptom of nasal sense of smell or loss of taste in Omicron patient? Thank you.
Yeah, now still the majority of cases are Delta, and only out of 1.2 lakhs or more of cases, only 4,000 are Omicron. So that you can see that the majority are still Delta variant. And for the Omicron cases, upper respiratory infection is a predominant one, and loss of smell and taste, some of them do report, but detailed statistics on the 4,000 cases now infected in India is still to come. You don't have detailed information about symptomatology. Other than that, it is mild.
Okay, thank you.
Good morning, everybody. Thank you so much, Saurabh, for having me on. So there are two parts of what I'm going to be presenting here. One is, of course, the official Maharashtra state government guidelines as they exist right now. I'm proxying in for a very, very senior and very respected colleague of ours. Dr. Shashank Joshi could not come to this meeting. So this is what the Maharashtra. Are you there, sir?
Hey, sorry. Yes.
Okay. The groups of patients that we are
No, we
looking
only
at.
have Sinopharm. Even then, we are down to the last 50 doses left only. Yeah.
Somebody's speaking.
I can ask for you.
Dr.
Okay.
Chang, yeah.
Yeah.
So the grouping here is very clear. We are looking at symptomatic and asymptomatic. Among the symptomatic, we are looking at patients without fever and the patients with fever. Saurabh, could I have that slide again, please?
Sorry, just one sec.
Yeah. So, at the very outset, I would say that I'm largely in agreement with Dr. Angelique because we are seeing, so I'm from Delhi and I'm going to be presenting my own experience also. So in asymptomatic, whether there are morbidities or no comorbidities, it is good to follow your patient, no tests needed at the moment and no treatment initiated. With the symptomatics without fever, you will observe if the cough stays for 5 days or more, then you will give inhaled steroids. In the symptomatic with fever, if there are no comorbidities, if the age is more than 60, currently the Maharashtra state government, in fact, even the Indian government is recommending oral antivirals, molnupiravir. However, they have a rider on it that this should be used with discretion. So this is left to the discretion of the treating doctors. The thing with molnupiravir is that it has to be initiated within the first 5 days. It has to be given for maximum of 5 days, and if the patient needs to be hospitalized within the course of treatment, then it has to be stopped. So that's where the rider for molnupiravir comes. Now, if fever persists even after 72 hours of medication with molnupiravir, then IV remdesivir is being recommended by the Maharashtra state government. There was another slide, I think. Yeah. So with one or two comorbidities, as I said, molnupiravir has to be started within 3 days of onset of symptoms. If they respond, 5-day treatment. If they don't and fever persists beyond 2 days of starting treatment, then you would admit the patient. Symptomatic with more than 2 comorbidities, they are recommending IV remdesivir to start and admission with your usual protocols to be followed as of severe COVID. Now, the second part of what I wanted to talk about was my own experience in Delhi. So we are seeing anecdotal reports of and press releases of how many cases, how many Omicron, etc., etc. And going by what is happening in India, when you report more than 1 lakh fresh infections, Mumbai and Delhi accounting for nearly 40% of that, Mumbai around 20,000 and Delhi around 17,000. And you're saying that the total Omicron is 3,000 from that 1 lakh. So resonating with what Dr. Pillai just said, that this is not yet a wave which is either we are not doing significant genomic testing to say that all of them are Omicron, or it is a wave which is a combined wave as yet not completely overtaken by Omicron. The third part of what I wanted to say here was that I am in an IENT hospital. So we see a lot of patients with cough, cold, fever, and largely, I would say that the test positivity in these patients is coming to more than 50%. So it is consistent with the ZOE data that if a patient is presenting with cough, cold, with or without fever, assume that it is COVID. Whether it is Omicron or Delta can only be made out with genomic testing, but clinically, this is so. Also, in our own hospital, dealing with patients who require surgeries, right now we have, as of today, stopped doing elective surgeries because we noticed that nearly 10% to 15%, which is consistent with the government reportage, 10% to 15% of those who are scheduled for surgery and who have no symptoms are turning out positive. These would perhaps be Omicron because they don't have symptoms, but they would need to be followed over the next week or so to be sure. Omicron, as Dr. Angelique says, largely results in milder illness. We have at the moment about 40 employees who have tested positive out of 450. All of them are under treatment and observation on an OPD basis under my care. All of them are having bad fatigue, bad scratchy throat, bad running nose, cough, fever, mild and low grade, 99 to 101. They are not showing any fall in oxygenation. They are all under daily monitoring. So long and short of it, till we start testing specifically to say this is Omicron, currently our wave is a combination of Delta and Omicron. Omicron is going to cause numbers to go up dramatically. However, even with the government hospitals, the reports from LNJP, from RML, from Safdarjung, mostly the sequenced Omicrons are coming from patients who have been admitted for other reasons. Despite that, one death in Delhi and one death in Bombay, as far as the reports are concerned, this is probably from their comorbidities and not from COVID. So it is a death with COVID and not from COVID. As far as boosters are concerned, the government is rightly calling it a precautionary dose, because if it is a booster, it would need to be given to the entire population. A precautionary dose in high-risk settings, so for healthcare workers, for people over 60, for people with comorbidities, it's a very graded and a very logical, scientifically dictated response. We still have to see how it pans out in a country like India. Largely, South Africa and India share a lot of demographies, as in we are both young populations. We both had a very bad Delta wave preceding this Omicron wave. We both have gradually climbing vaccination rates, but South Africa was lagging behind India in that sense, and yet its Omicron was not a very lethal wave. There are some modeling studies going on which predict that India could see upwards of 400,000 cases a day, and Delhi and Mumbai particularly could feel the brunt of it. But these are just case numbers, not hospitalizations. As of now, even today, hospitalizations and case numbers have uncoupled and decoupled. I think if anybody has any questions, I would be glad to answer them, but that is what I have to say. Thank you so much, Saurabh.
Thank you. I just want to add over here, there was somebody was asking about, the loss of taste and loss of smell for this particular thing. So we had some data which has come out recently with the comparison of first wave, second wave, and third wave, where it says this loss of smell and loss of taste was complete and onset at the first wave, and this second wave it was like complete and partial. But the third wave, which we have experienced in India, there is no loss of taste and loss of smell, and doctors can correct me over here. Even in the cough and cold, there was a dry cough, no cold, dry cough, no cold in the first and second wave. Where the third wave, it says cough and cold both are there. Chest congestion, in the first and second wave. The first wave, it says lung CT scan shows a COVID jelly. The second wave also, it shows the COVID jelly detected. By the third wave, it says no COVID jelly formation was there. Fever was high grade in first and second wave, whereas it was a low grade in the third wave. And it's still a third wave. The weakness was severe in the first and second. It's milder in the third wave. Respiratory, severe in comorbid patients, severe in many patients in the second wave, rare in the third wave. Hospitalization was more than 10% in the first and second wave, whereas we have only seen 1% hospitalization, less than 1% for the third wave. So I think this was a very important data which I wanted to present.
Yeah, so Saurabh, there is only one thing that I would like to add here, and that is so fatigue, when you say very severe and when you say mild and moderate, that is really a very personal thing, because the patients that I'm seeing, fatigue is a significant complaint. And for the first 2 or 3 days, it is significant enough for them to want relief. It's responding well to a combination of, yes, Dr. Angelique says, remember the muscular pain, fatigue. So it is responding well to nimesulide and mefenamic acid combination. Paracetamol, even though it is in the national guidelines, is not doing much to help. I would say that we should, as clinicians, focus on what is our experience, do the best that we can for our patients, keep updated, and carry on. This wave is likely to hit very high numbers. All of us are going to be exposed. However, the silver lining is that it is likely to be like a live attenuated vaccine, for the want of a better word. I don't want to sound very carelessly optimistic, but I would say that careful, cautious optimism is probably the right way to go forward. Dr. Akhtar wants to ask a question, I think.
Thank you, Doc. Excellent Maharashtra presentation. I'd just like to know the rationale behind using of remdesivir, while many other protocol is not having any benefit. So what are the clinical benefit you had, Doc?
Dr. Akhtar, this is what I told Saurabh, because today Dr. Shashank was unable to join in, and I told him that I'm going to present proxying for him, which is a great honor, but I don't agree with this. So, so this is something that I think the Maharashtra protocol is something that I'm not in complete agreement with.
Okay, so Dr. Monica, would you like to end? And I think we have.
Well, Saurabh, I just want to give one comment.
Yeah.
In spite of say low symptoms, high infectivity, we need to understand that the moment it is so highly infectious, the number of people getting infected would be in millions, and even if 1% of them die, you'll have more than 100,000 people dying. So I think we shouldn't take it lightly, because it is less symptomatic. We have to take it still seriously to stop it. And I think the only thing that we have at present is mask. So through this platform, we should convey that only thing that can help you is mask, because even the vaccine is not helping. So I think we need to take it serious.
And Dr. Arun, I would go a step further and say that not just a mask, but a proper N95 well-fitted mask.
Yes.
The test would be that if your glasses are getting fogged when you're wearing the mask, it's not a good fit. If that is happening, then please use surgical tape or steri tape on the nose pin, so that the mask is well-fitting. make sure that the sides of the mask are well fitting also.
Thank you. So, considering the time, Dr. Monica, would you have anything to last?
Yes, so I just wanted to follow up on the question that I was asked regarding what is the rate of hospitalization of those with Omicron. And I would like to actually tail on Dr. Pillai's comment that the data is very premature and we don't have a lot of information. Right now, what we have is a lot of data regarding hospitalizations from those who are vaccinated and those who are unvaccinated, and that we truly don't know what the true infection rate is, because many people are asymptomatic, as Dr. Dhawan had mentioned, that in the patients who had scheduled procedures, they were picking up a 10 to 15% rate. So in that scenario, I did look for information and data that's been reported to date. And what I did find, and I did post in the chat, was that in the UK, they found that the Omicron hospitalization risk is 1/3 of Delta. And then in a US study that was published in preprint, was that the hospitalization risk was half the risk observed with the Delta surge. And so I agree that we need to use masking, distancing, and correct decisions in terms of risk assessment and the behaviors. I still think that but despite the anticipated exposures that we all are going to have in what we do on a day-to-day basis, we need to prevent the infection, and we still cannot let down our guard. And I still think that we need to continuously evolve our treatment strategies and to understand early detection of those who are around us. And with us right now, we're having a very difficult time because we are surging with all the viruses, whether it be RSV, whether it be influenza, whether it be Omicron, whether it be any of the other winter-based viruses. And I think we just need to have a blanket approach that we just do not want to get sick. Thank you again. And that's all I wanted to say. Thank you.
Thank you, Dr. Monica. And I believe everyone has spoken. Anybody left? Otherwise, we will wind up the meeting. I hope we have covered all the countries here.
Saurabh, anyway, we don't have the next meeting. So let expert take some time in case they want.
I think we've already covered more than 1.5 hours. So I think people have to go back to the work. So Dr. Chong, would we end the meeting now? Anybody has a question or comments before we can do that? So I think it was a great session. It was a great, insightful, much needed information which was coming around from the world. Dr. Chong, over to you.
Thank you. Thank you all again for a most interesting session. And we all look forward to seeing you next week. And Happy New Year to all. And best wishes to you and your loved ones at home. Thank you all.
Thank you, everyone.